Every woman, each pregnancy, each labor is different. There's so many variables. The time you take in the labor room is different from another one's time. Your waters may break in the first stage of labor, others in the second stage. Welcome to the Nursing Moms and greetings from Nurse Janet. In this video today, I'm going to talk about the normal delivery, what happens in each and every stage of labor, and what to expect, and how long it can take to have the normal delivery. All the three stages explained. Watch to the end. The first stage of labor. Actually, there's so many changes that occur in the first stage of labor. It runs between a period of 12 to 19 hours, but again with so many variables, like it can go past that or it can even come before that time, before the 12-hour mark. All the true labor signs are in this stage of labor. You'll realize you're having the show, that blood-stained mucoid discharge is there. The cervical mucus plug has been pulled out and the cervix starts to dilate in this stage. Actually, the cervical dilatation will cut across from the way it was, from the 0 or 2 centimeters up to the 10 centimeter when you'll be entering the second stage of labor. In this stage of labor, we have strong, rhythmic, and regular contractions. You'll be having contractions like if you had them like after every 10 or even 15 minutes, they'll continue in intensity and you'll be receiving them from the 8th to the 5th minute, and again, it will continue as time goes by. Very, very strong, regular contractions. That is if the labor is going on well. In this too, you'll realize you'll be having back pain in the first stage of labor. Again, you realize your water can break in the first stage of labor. It's normal. The first stage of labor has two phases, that is the active and the latent phase. The latent phase, when the contractions are still irregular and the cervix has not dilated or has dilated up to the 4th centimeter. And again, from the active phase, the cervix dilates throughout from the 4th to the 10th centimeters. That is when it can allow the passage of the baby's head. In the first stage too, there is effacement. The baby's head goes down in the pelvic or in the birth canal. During this stage, the mother needs to stay informed, hydrated, calmed, and at least have some movements up and down. You just don't have to be in the bed the whole day, like laboring in the bed. If you have the pain relieving techniques, you can as well apply them. The second stage runs from when the cervix is fully dilated up to when the baby is born. There are several signs and symptoms that will show you a mother is already in second stage. One of them is having a fully dilated cervix. When the cervix is fully dilated, that is up to the 10th centimeter. That is when it can allow the passage of the baby. Again, another thing that will show you the mother is in a second stage is having the baby's head crowning. Crowning is having the visible part of the baby's head being seen outwardly. Actually, again, it's in this second stage that after seizing the pelvic or the birth canal, you can give an episiotomy cut to aid in the delivery of the baby. The second stage also is marked with unresistible urge to pull. Actually, the baby's head will be pressing on the rectum, and if at all there is any fecal matter down there, you don't have otherwise, you only have to pull because the feeling is almost the same as the feeling of the contraction feeling of giving birth. And again, in this stage, the mother is encouraged to push with each and every contraction coming by. If there is no contractions, the mother is encouraged to breathe in and out comfortably. She can lie on the left while there is no contraction. But if the contractions come, the mother is encouraged to push with each and every contraction. After the baby's head is out, you have to check of cord around the neck. If not, let the baby's shoulders rotate spontaneously and the whole body will be out in a sliding way. Cutting of the umbilical cord that connects the placenta to the baby should be done. In the second stage, to mark the end and separate the baby from the mother. The third stage of labor, the baby is already born and you want to know the gender of your baby, you've been shown. Now we have to do the skin to skin contact. Your baby will be put on your abdomen for warmth. And again, you'll feel a little bit of contractions, not the way they were before, but there are some still contractions to help aid the expellation of the placenta. Again, another thing here is that your uterus will get back into a little bit smaller size, but not fully contracted. The doctor will expel any clots and again assess the blood loss in this stage of labor. Again, if you had an episiotomy in the second stage, it is in this stage that there will be a repair of your episiotomy. The fourth stage of labor, this runs from 1 to 4 hours post-delivery. It is just a time that the doctor will be observing you post-delivery. Actually, if at all there is any complication, you need to report to the doctor. The complication can be bleeding. If at all you're having excessive bleeding, you have to report. You are expected to start breastfeeding immediately you are out of the delivery coach and you've freshened yourself. Get your baby, hold her, start breastfeeding immediately. Congratulations.